Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 16th of December 2020, and the starting news really from the numbers is that today we're showing 128 COVID positive patients in our hospitals. That's patients who are within 14 days of a new diagnosis of COVID-19, and that is an increase, I'm afraid, on last week when we were talking about 121. So we're showing 108 patients on our general wards in the hospital, 15 patients at Clifton and 5 in our intensive care unit. And I'm sorry to report 19 new deaths of patients who are within 28 days of a diagnosis of COVID over the last week. So you'll see that far from going away, the issue is remaining a big problem for us, and we can see from the community data that actually compared to last week there's been a slight increase, I'm sorry to say, and we also know that within that increase there's a very high proportion of people who are over the age of 60. So as age is an independent risk factor for being poorly with COVID, that is an uncomfortable position to find ourselves in as a health economy. So if we then think about that in the context of Christmas coming, and with all of the things we're hearing about on the media, I think the message has to be that everyone has to be really careful through the Christmas period, and as individuals and as family groups we have to make some really thoughtful decisions about how we manage that to try and restrict transmission between generations, so that we're careful about older and vulnerable people mixing with younger people. If we are together in confined spaces, we try and distance as much as possible. We try and maintain ventilation through our homes and houses and places and so on, just to be thoughtful really about the risk that we will be posing to maybe ourselves and to vulnerable friends and relatives, and then to others who we don't see in front of us but are nevertheless involved in those transmission pathways. One thing is clear is that there is a lot of testing capacity available on the Fylde coast, so that for anybody who thinks they may have COVID, who has the classic symptoms, shall we say, of temperature or a continuous cough or of loss of smell or taste, but actually anyone really with flu-like symptoms, it's very easy to get a COVID test at the moment, and that can be done either by dialing 119 or by going on the gov.uk website and getting a test. So I'd absolutely urge people to do that if they're in any doubt about whether they may have COVID or not. Other things to say, I think, about immunisation. We started the immunisation programme last week on site at the hospital using the Pfizer vaccine, and that programme is going really well. The priority groups, of course, are people over the age of 80, staff and residents of care homes, and then NHS staff who are at high risk. And we are beginning to work our way through the NHS staff at high risk, but the priority in the categorisations is, of course, over 80s and residents and staff of care homes. As GP surgeries begin to come online with the immunisation provision, the whole capacity increases, of course. So really everyone needs to be on the lookout for some indication from their own GP surgery about when they might be called for the immunisation, and those groups remain, as I've said. Within our own NHS staff, we're of course risk assessing that to do with our staff who have been shielding, who maybe are showing up at high risk on our own risk assessments and have had to modify work accordingly. And then by age, which is of course an independent risk factor. So again, to everybody really, we're working our way through the programme, both for everyone in the community and in the NHS, and we will call you when you get to the right point on the risk and the risk assessment. So I think the final message is that clearly COVID has not gone away. If anything, it's flat or rising a little bit. We all need to remain incredibly vigilant, thinking about our own health and well-being and absolutely about those around us. And thank you very much for sticking with it.